It's a minimally invasive procedure that removes body fat and tightens skin for a smoother, toned look. Joining us to share more about SmartLipo is patient consultant Kelly Ivy-Subak from Dermique in Feeding Hills. Kelly, nice to have you here.
Nice to see you again.
As always, nice to talk to you. SmartLipo is something that is for all body types. Anyone can get it done. I think a lot of people may feel maybe embarrassed that they don't need it or that they can't get it.
There's the two sides. It's the people who feel like, oh, I'm being ridiculous, I should just go to the gym. You know, it's this one area I have a problem with. Or it's the other people who think I'm beyond help. No one can help me. And that's just not true. We can help anybody, everybody.
Now, what is the procedure like when they come in just to chat with you?
It is very low key. Nobody needs to feel uncomfortable or pressured. It's really just a conversation to educate the patient on what's involved, explain the procedure, talking about cost, and how I can help them move forward to the next step.
But there's no obligation, no fee for that?
Not whatsoever. It's really just an education time for me to let them know that it's not as big a deal as I think it is and help them move along.
Yeah, and then they can make the decision from there. And this
Absolutely.
is a good time because it's getting colder.
It is. This is a time so many people put it off during the summertime because they have their vacations and their trips. And now that kids are back in school, we're on a regular schedule, people can feel good about putting their garment on and having the treatment.
Wonderful. Well, we encourage people to go and talk to you. You're so easy to talk to, Kelly. And I went and saw you last week and we learned more about SmartLipo. We actually talked to one of your patients. So you can take a look at that now.
SmartLipo, I think, is kind of confusing for some people because they don't know if it's an alternative to traditional lipo and it's its own thing. It was designed by physicians who were looking to originally do small areas of the body that were too small to do with the traditional cannula for SmartLipo, but had to get really right in there. And it did a brilliant job. And what they discovered over time is that it's actually even more effective than traditional lipo. Reason being is that when you do traditional lipo, I always give the analogy of you've got the full balloon. You take the air out of the balloon deflates. When you do SmartLipo, you take the air out of the balloon, you restore the balloon to its original shape. So you're getting that skin shrinkage from underneath so that you don't need the tummy tuck or the skin pulling after. It's done in office. You don't have to go to the hospital. You don't need general anesthesia. Takes about 2 hours depending on how many areas of the body that you're doing. It is all done with 1 little inch incisions in whatever part of the body it's being done at. It's very quick, it's painless, there's absolutely no pain involved whatsoever. You leave here, you go home, you take it easy that day, you're back to work usually on Monday. So we do the procedures on Saturday and Sunday so we don't interfere with people's lifestyles. And then you're right back to work. So it's probably been the most successful procedure that we offer and probably the procedure that we get the most positive feedback about. Most common problem areas for women is going to be the upper and lower abdomen. We do a lot of that post-baby belly area. We do the post-menopausal when women start noticing that their bodies are changing. Flanks, which is the side of the body and our waist area. Also that bra fat right in the back. I get a lot of complaints about that. Next would be inner and outer thighs. For women, that's the basic areas. For gentlemen, it's gynecomastia or fat in the breast area, tummies, and love handles, that flank area. Dr. Swizeski's been doing SmartLipo for about 8 years, and in that 8-year time, we've had so many happy patients, and we were blessed today to have Judy come in and talk about her experience. And she's just one of the hundreds of patients that he has treated and really changed their lives.
It was pretty non-invasive. It didn't hurt. The staff here was wonderful. They make you feel very comfortable. I love it. It's quiet, it's relaxing, it's very tranquil, and I enjoy coming here. I'm very happy with it. I feel like if I put something on, I'm not having different things hanging out in different places. It made me feel better. I'm just not as old as I am in years. And I think you have to feel good, not for anyone else, just for yourself.
In this office, they can feel very comfortable about that because that's what we do here all day. We are not a judgmental staff. We're here to help you. And I try to think about how much energy we put into being self-conscious about that area, getting dressed, getting ready for the party, going to work, just going out into the world. We worry, is it showing? Is this the right outfit for that? If you remove that area and it's no longer an issue, think of how much free time you have with your mental powers. You can do anything after you're no longer worrying about that. I think it's probably the greatest gift I can give somebody is that self-confidence back.